Todd Ellerin, Director of Infectious Diseases at South Shore Health. Doctor, thank you for joining us. Big news today. The state's plan to bring students back to the classrooms this fall. How challenging is this going to be?
This is really good news, Maria. I think our kids need to get back to school. Remember, they do represent the least vulnerable group, so they do really well with COVID-19. I think we still have to understand transmission back to more vulnerable populations. That needs to be worked out, but I think the governor has issued some guidance as far as, parents giving kids that are above at the second grade or older masks. They're going to have breaks with this. Good hand hygiene. The desks are going to be spaced out at least 3 or 6 feet, so they'll be able to have more kids in the classroom at a reasonable, distance. So I think they're thinking the right way about this.
Doc, let's expand on that a little bit. What do we know right now about the ability of children to transmit the disease, or children even become infected?
Okay, so Ed, it's an important question. We know a few things. We know that when you think about the global pandemic, kids under 18 only make up 2% of that. So for whatever reason, they don't get infected as often as like kids do with influenza, who make up a very large part of this. As far as transmission is concerned, that's a little bit of a different story. Some of the observational studies in Europe and China actually show that kids may not transmit the virus as much as adults do. Now, that's because one of the reasons is we haven't seen a lot of outbreaks in schools. But we have to be careful because with this pandemic, there were a lot of school closures and we may not have been testing as many of the children. So I think it still remains to be seen.
Doctor, I have to go back to something that you said, and these are the recommendations, 3 feet, 6 feet. All we've been saying since March is 6 feet. What's the 3 feet?
Well, I think, remember, so 6 feet is the ideal, okay?
Right.
But remember, the Lancet came out with a study that was funded by the WHO, and they actually showed that if you were 3 feet away, that you had significant reduction in infection compared to if you were within 3 feet. Now, if you were at 6 feet, you actually had half the risk. So there was a significant risk. The further we're apart, so we have to balance that with, also having kids in the classroom. I mean, right? And kids being less vulnerable. I do think while 6 feet's ideal, I would accept between 3 to 6 feet for my child.
We've been hearing an awful lot about, there is likely to be a second wave and perhaps in the fall. So are you concerned that, when school starts in the fall and kids go to school, that could help trigger a second wave?
So I'm very worried about the second wave in the fall. So far, the evidence doesn't support that the kids are necessarily going to be the major drivers of that, but we do have to keep that in mind. One thing I would say, since we don't know exactly how often kids transmit back to adults or more vulnerable children, it's important back in the home that if there's vulnerable people within the home, you may want to think about how to reconfigure that. Maybe more mask use, maybe more physical distancing, at least at the beginning, until we can figure this out.
In the home itself, right?
In the home itself.
Great, Doc. Thank you so much.
Thank you, Doctor. Dr. Todd Ellerin, South Shore Health. Be well, as always.
Take care, Doc.
Thanks, Doctor.